So today we're diving into something that might sound simple at first, vitamin B12 deficiency. But here's the twist. We're not just talking about the usual symptoms like fatigue or anemia. We're going to explore the weird symptoms, the ones people don't always expect, and more importantly, why they actually happen. By the end of this video, you're not just going to know the signs of B12 deficiency. You'll understand how it works, why these symptoms happen, and how doctors actually diagnose and treat it. So yeah, stick around, especially if you or someone you know has been feeling off lately and you just can't figure out what's going on. This might be the missing piece. Oh, and before we get too far in, if you find this kind of content helpful, easy to understand breakdowns of complex medical topics, go ahead and like the video, hit that subscribe button, and maybe even share it with someone who might need it. It really helps us out and keeps more lessons like this coming your way. All right, let's jump into it. So what even is vitamin B12 deficiency? Vitamin B12, also called Cobalamin, is a water-soluble vitamin that your body absolutely depends on. It helps you make red blood cells, keeps your nervous system working properly, and plays a big role in brain health. But the key thing here is your body can't make it on its own. You have to get it from food. And not just any food, we're talking animal products: meat, fish, eggs, poultry, and dairy. So if someone's on a strict vegan or vegetarian diet and they're not supplementing, they're at risk. Now you can become deficient in two main ways. Number one, you're not eating enough of it. Pretty straightforward, right? But number two is where it gets a little sneaky. You're eating enough B12, but your body just isn't absorbing it properly. One classic example, pernicious anemia. That's when your own immune system attacks the stomach cells that produce intrinsic factor, this special protein that helps absorb B12 in the small intestine. And other things can mess with absorption too. Long-term use of acid-blocking meds like proton pump inhibitors or metformin, or if you've had weight loss surgery like gastric bypass, or if you've got gut conditions like Crohn's or celiac disease. Yeah, lots of ways this can go wrong. All right, so let's talk symptoms, starting with the strange ones. One of the big areas affected is your nervous system. And I know you might not think of a vitamin deficiency as a neurological issue, but in this case, it absolutely is. B12 helps your body make myelin. That's the protective coating around your nerves. Without enough B12, that coating starts to break down. And when that happens, nerve signals slow down or get jumbled, or just don't get through at all. So what does that look like? Well, people might feel tingling or numbness, especially in their hands and feet. And here's something to notice. It's usually symmetric. So if you feel it in one leg, you'll probably feel it in the other. Some people get a burning sensation, like pins and needles that won't go away. There's also a loss of balance, especially in the dark. Like when you close your eyes, you suddenly feel unsteady. That's because your body can't sense where it is in space. We call that proprioception, and it's one of the first things to go when the dorsal columns of your spinal cord get damaged. Now here's a really weird one, reduced two-point discrimination. Let me explain that. If I touched your skin with two pins that are kind of far apart, you'd feel two separate points, right? But as I move them closer together, there comes a point where it just feels like one touch. In B12 deficiency, people lose the ability to tell the difference even when the points are still kind of far apart. That's a clue that the sensory nerves are struggling. And then there's the walk. Some people develop a shuffling gait. It's slow, stiff, kind of dragging their feet, almost like Parkinson's. And they might be hunched forward, taking tiny steps, just trying not to fall. Another thing, reflexes can drop, especially in the ankles. So when a doctor checks those with a little hammer, you might barely react. Now let's talk about the brain stuff. People with B12 deficiency often describe brain fog, forgetfulness, slow thinking, or even personality changes, and in older adults, it can look just like dementia. But here's the important part. It's reversible. If it's caused by B12 deficiency and you catch it early, treating it can actually restore memory and clarity. Mood changes are common too. Some people get depressed, anxious, irritable, or just feel emotionally flat. So yeah, a vitamin deficiency can absolutely affect your mental health. And honestly, it's often missed because people don't think to check B12 levels when someone's having mood issues. Oh, and for the med students watching, if someone shows up with cognitive symptoms and macrocytic anemia, think B12 deficiency until proven otherwise. Now let's shift gears a bit. Let's talk about what happens in the mouth. One common sign is something called glossitis. That's just a fancy way of saying the tongue is red, smooth, and kind of sore or burning. Some people say their tongue feels itchy, or even like it's swollen. Over time, those little bumps on your tongue, called papillae, they can disappear, making the tongue look totally smooth. Another thing, Angular cheilitis, those painful cracks in the corners of your mouth. If you've ever had it, you know it's not fun. Now let's move on to the blood-related stuff. So B12 is critical for DNA synthesis, especially in red blood cells. Without it, the bone marrow starts churning out these oversized, immature red blood cells called megaloblasts. This leads to macrocytic anemia, meaning the red blood cells are larger than normal. Symptoms here include fatigue, even with mild exertion, feeling lightheaded or dizzy, looking pale, especially in the skin and under your eyes, shortness of breath, and in more severe cases, even heart palpitations or chest discomfort. And just to clear up confusion, iron deficiency causes microcytic anemia, tiny red blood cells. B12 deficiency causes macrocytic anemia, big red blood cells. All right, so how do we diagnose all this? Doctors usually start with a serum B12 level, but here's the catch. Sometimes it looks normal, even when it's not. That's why we also look at methylmalonic acid and homocysteine. When B12 is low, both of these go up. A CBC might show large red blood cells with a high MCV, and if you do a blood smear, you might see something called hypersegmented neutrophils. That's a classic exam clue. And if you suspect pernicious anemia, doctors might check for intrinsic factor antibodies or parietal cell antibodies. Okay, so how do you treat it? It really depends on the cause. If it's from diet alone, oral B12 supplements or fortified foods usually do the trick. But if it's an absorption problem, like after surgery or with pernicious anemia, you'll probably need B12 injections. Typically, that starts as once a week for a month, and then monthly for maintenance. Some newer oral formulations use super high doses that can work even without intrinsic factor, but that needs to be monitored case by case. And the good news? Most people feel better within a few weeks of starting treatment. Fatigue improves, mood improves, even oral symptoms start to settle. But, and this is important, nerve damage takes longer, sometimes months, and in some cases, if you wait too long, it might not fully reverse. So yeah, early diagnosis really matters here. One last point. Kids with chronic B12 deficiency may show poor growth, developmental delays, or even failure to thrive. This is especially important in regions with poor nutrition or in infants of vegan mothers not taking supplements. All right, before we wrap up, let me give a few quick exam tips for the students out there. Here's an easy way to remember the big stuff. B12 equals brain, balance, big cells. Brain, cognitive changes, depression, irritability. Balance, proprioception issues, shuffling gait, neuropathy. Big cells, macrocytic anemia, megaloblasts, hypersegmented neutrophils. And don't forget this classic board question. Methylmalonic acid is elevated in B12 deficiency, but not in folate deficiency. So if both B12 and folate are low, MMA helps you figure out which one's the real issue. And always remember, only B12 causes neurological symptoms. Folate deficiency doesn't mess with your nerves. So yeah, to bring it all together, vitamin B12 deficiency is way more than just feeling tired. It can show up in the brain, the nerves, the tongue, the skin, even how you walk. And the symptoms can be subtle, strange, or downright confusing. But once you understand what's going on behind the scenes, how B12 affects your nerves, your blood, your brain, it all starts to make sense. If you found this helpful or learned something new today, go ahead and like the video, subscribe if you haven't already, and drop a comment below. Maybe share your own experience or ask a question. You never know. Your comment might help someone else too. Thanks so much for watching, and I'll see you in the next lesson.